Hello there, I'm Dr. Purnendu Roy. I'm a surgeon in Genesis Hospital Kasba, Kolkata. Everybody has got a lot of fear before they go for surgery. And the main questions that are usually asked regarding pain, recovery from anesthesia, what are the risks, what are the complications? And one of the things that they keep asking is there a chance of formation of a hernia after the surgery is done? So today I thought we will discuss what is hernia, what are the symptoms, and how to diagnose and how to prevent a hernia formation after any abdominal surgery. Hernia is when an organ pushes out of an area which is held by a muscle or tissue. So let's take an example. Like suppose in the groin area, if there is a weakness, an internal intestine or fat comes out and causes a bulge, or near the navel due to a weakness, internal structure causes a bulge, that's called a hernia. And hernia can occur also if there is a weakness after a surgery and through the gap it comes out. Or hernia can have internal herniation within the abdomen. So let's now try and find out what are the different types of hernia. One, if it happens near the groin, then it is called inguinal hernia. It can also be femoral hernia. If it happens near the navel, then it is called umbilical hernia. Third, if a hernia is there in the abdominal wall in the midline, above or below the navel, it's called a ventral hernia. The ventral hernia can actually be present from birth due to a defect, or it can happen after a surgery when the scar has become weakened. The fourth type is called hiatal hernia, because in between the chest and the abdomen there is a diaphragm, there is a membrane, and through which the passage of food pipe, which is esophagus, comes down and joins with the stomach. If the stomach herniates up through that orifice of the hole in the diaphragm, that's called a hiatal hernia. So now we have understood 4 different types of hernia. So first let's try and find out what will be the symptom. It's very simple, because wherever the hernia, there will be a bulge or swelling. If it's in the groin, like inguinal hernia or femoral hernia, there will be a swelling in the groin area. If it's in the navel, then there will be a swelling in the navel area, or for that matter, if it is an incisional hernia, wherever you have had the surgery in past, that area will get swollen up, and so the patient themselves will know. But what about the symptom of hiatal hernia? Now these are usually gastroesophageal symptoms, because the person can complain of heartburn, like as if acid is reflexing up, and sometimes a feeling of uncomfortableness in the lower chest or upper abdomen. A large number of patients may not have any symptoms, and they're completely ignorant and not aware that they could be having a hernia. And that is the main reason why it is important for all people to go for regular health checkup. And that's why we also suggest that in case if you are checking your water filter, car and AC and everything, what about your body? So please always remember, at least once a year, health checkup is necessary. And do you know how a large number of hernias are picked up? Because wherever you go to join in college or army or any place, after you get selected, the first thing is medical checkup. And many times such hernias are picked up because they have never actually felt that they had a hernia. So what are the causes why hernia should take place at all? Number 1 is congenital. If you have certain weakness from the time of birth, many times we describe the navel as inward or outward. From the time of birth, there can be a weakness in the navel area, which later on can develop into a hernia. Number 2, if a person has got chronic cough, a smoker or COPD, chronic obstructive pulmonary disorder, somebody who is day in and day out continuously coughing. So what happens is natural areas of weakness in the muscle gets pressurized, and these can give rise to herniation later on in the navel or the groin area. Those who are into very strenuous exercise, professional weightlifter, people, they just keep trying to lift weight, or people who are laborers trying to strain a lot to pick up weight, they can get hernia. One more reason is if you are chronically constipated. Now, how constipation? Because if you are constipated, you are likely to sit in that little room and keep straining like that. But that's not going to help. You should treat constipation instead of straining, because regular long-term straining can give rise to hernia. Multiple pregnancies can sometimes weaken your abdominal wall and give rise to hernia. One more reason is if you develop ascites, ascites is when accumulation of water in the tummy from liver disease or cirrhosis, when the tummy gets blown up like this, that causes weakness and cause hernia. Last but not the least, overweight, obesity. Yes, among many other things that obesity can cause also hernia. So now we have understood what are the things that can give rise to hernia. We have understood what are the symptoms. We have understood why a hernia occurs. Now the question is confirming the diagnosis. A lot of people will ask, do we need to do any test to confirm a hernia? Most of the time hernia is obvious. It's a swelling and it can be reduced inside, and you can literally feel the gap and see the area. See, in such obvious cases you may not need a particular test, but in a small hernia in the navel you may need an ultrasound scan to confirm whether there is a gap in the navel, yes or no. And in an incisional hernia, you may need to do an ultrasound scan to check how big is the gap where the stitches have given way. Once you have confirmed the diagnosis, next is the treatment. A lot of patients tend to ask, Dr. Saab, can't we get some kind of a medicine or tablet? Let's try and understand. It's a defect. It's a defect in the muscle. No, you can't give medicine to stop a defect through which things are coming out. It requires surgery. So is there anything that we can do without doing surgery? One is, what about prevention before the hernia takes place? If you have got chronic cough, if you're a smoker, just quit smoking. If you have got chronic cough, get treated. If you have got COPD, go to a chest specialist. If you have got severe constipation, instead of straining every day, get into a habit of taking high fiber diet and take laxative. Avoid lifting heavy weight, and also try and develop and build muscles in your abdomen, like getting a six-pack or strengthening abdominal muscles by doing crunching. So these are the things if you take care of and don't do things which I spoke, that what are the things which can give rise to hernia formation, then you will be fine. But once it has taken place, once a hernia has taken place, nothing else can be done other than surgery. And surgery, we can do it in two ways. One, which is conventional surgery, and two, which nowadays is called laparoscopic or minimally invasive surgery. Now the basic principle is, wherever is the defect, whether it is in the groin, navel, or in a surgical scar, the defect has to be repaired, and also a support has to be given. And olden days, the hernia repair used to have some amount of failure and recurrence only because we were not using mesh on a regular basis. Nowadays, it is mandatory, whatever be the type of hernia, when we do the repair, we put a synthetic mesh. And this mesh gives us support to that area when it is sutured. In case, if you need any help with the specific type of a hernia, what you can do is get in touch with us in Genesis Hospital Kasba in Kolkata in the following numbers. So if you enjoyed watching this video, please like, share and subscribe to my YouTube channel and continue watching several more videos to come up on healthcare, education, our charitable work and about food and beverages, about our Ecclesiastes cafe and its work. Keep your eyes on the next upcoming videos on different types of hernia, which is groin hernia, inguinal and femoral, umbilical hernia, incisional hernia and hiatal hernia. Thank you very much for watching this video.